I am Dr. Girija R Varier. I am a fetal medicine consultant at AM Medical Center. Today I would like to tell you what is a fetal medicine department all about. In obstetric and fetal care, a time came when people became more concerned about how the fetus is doing. A fetus is the unborn baby within mother's womb. Now, the obstetrician or the treating gynecologist takes care of a lady as soon as she becomes pregnancy test positive. So, her diet, her medications, her checkups, her investigations, everything is looked after by the gynecologist or the obstetrician. So, who takes care of the fetal well-being? Of course, it is the duty of the obstetrician to take care of the baby along with the mother, because it is the fetal maternal unit that we are concerned about, and it is the excellent care of both the units that result in a good outcome of pregnancy. However, since the fetus cannot be directly examined physically by the obstetrician, a department called Fetal Medicine was created to take care of this unborn baby. So, what are the responsibilities of a fetal medicine department? In a fetal medicine department, there is a certain aspect called fetal imaging, where the baby is scanned in several stages of pregnancy to see how the baby is growing, whether the baby is having any abnormality, whether the baby is in a good environment inside the mother's womb, and whether there are any chances that the baby will be at a risk of developing chromosomal or structural or genetic abnormalities. So, fetal imaging is done by an ultrasonography machine, and ultrasonography does not involve any ionizing radiation. So, in all the 3 trimesters of pregnancy, when a pregnant mother will be prescribed scans, please go ahead and do each one of them, because all of them contribute to a fetal well-being and a wonderful outcome of pregnancy, where the mother will be giving birth to a healthy baby. Apart from fetal imaging, the other responsibilities of fetal medicine department are counseling, which is a very important part of fetal care. Counseling may be a general counseling or a genetic counseling or specific counseling, where the parents will be given information on detection of certain abnormalities in the baby, or given information on certain abnormalities which can happen and where we are seeing a higher risk of having them. Now, when such a situation arises where the fetus is at a risk of certain abnormalities but are not confirmed by the scans or the screening blood tests that are done along with them, in those cases we advise invasive tests. These invasive tests are done in several ways. We can take some fluid from the womb which is surrounding the baby, or we can take a bit of placental tissue which is called the chorionic villus sampling. So, be it amniocentesis or a chorionic villus sampling, we are directly testing on the fetal cells, and we can confirm the abnormalities which we are anticipating that the baby might be having. So, a diagnostic or an invasive part of fetal medicine department has added significant value to fetal care and is a very important part in obstetric and pregnancy well-being. So, I stop here today, and we will go ahead in our next video with what are the scans which are done in each trimester of pregnancy. So, see you soon.